Hi guys, and welcome in today's session. In today's session, we're going to talk about carpal tunnel syndrome. What is it, the test that we do to diagnose it, and the treatment management of it. So the first thing, what is carpal tunnel? Carpal tunnel syndrome is the compression of the median nerve in the carpal tunnel in the wrist, and this is going to affect the first, second, third, and half of the fourth finger. Usually this is going to be tingling, pain, and numbness. Symptoms are going to be worse at night, and this condition unfortunately happens very often in the third trimester of pregnancy, and also for people that do have jobs that require them to do repetitive movement with their hands, such as like typing in a computer for long hours. The first test that we do for the carpal tunnel is the Fallon test. For this test, you bring both hands together and you hold them against each other. If you start to feel the pain and tingling down the first, second, third, and half of the fourth finger, or any reproduction of the symptoms, this is a positive test. You want to make sure to keep this position for at least 1 minute before determining if you do have it or not. The second test is the tapping test. In this test, you simply tap on the carpal tunnel and you do check if you do have that recreation of symptoms in the first, second, third, and half of the fourth finger. If you're convinced that you do have carpal tunnel syndrome, then the first thing you're going to work with is your diet. You're going to decrease your salt intake, you're going to increase your fruits and vegetables, and you're going to keep a small amount of food, fish, and dairy. Then you're going to do the gliding exercises. These are very easy exercises that need to be done about 2 to 3 times per day, 5 to 6 days a week. I'm going to show that to you right now. For all these exercises, you want to make sure that your wrist is straight and you're not bending backwards or forwards at your wrist. Just going to bring the fingers down as demonstrated in the video, and you want to do about 10 repetitions of this exercise. The second exercise is the hook. For the hook fist, you're simply going to bend and curl your fingers and bring them to your palm. Again, avoid any bending forward or backward at your wrist. The third exercise is the flat fist. Check again your wrist, and you might start to feel some tension here in the area of your forearm, and is normal. Just keep on doing the exercise for 10 repetitions. And then the last exercise is going to be the closed fist, and you want to do about 10 repetitions of this exercise. And after you finish a set of 10 repetitions each exercise, you want to do at least 3 sets every day, 5 to 6 days a week. After doing these exercises, you want to be able to stretch the area. So a very good stretch is to simply bring the hand forward and use your other hand to pull the fingers backwards towards yourself. You want to hold the stretch for about 30 seconds. However, this can be very painful if you do have an active carpal tunnel syndrome. So just go to the point before that sharp pain starts. You want to do the stretch about 2 to 3 times every day, holding it for about 30 seconds to 1 minute. Thank you so much for watching, and I hope you have a wonderful day.